Hello everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jagos. Today I'll be doing Robert's chapter 25, the second part of manifestations of latent psora. Well, the psoric manifestations are ameliorated by the eliminative functions, and conditions such as diarrhea, perspiration, or even a free urination may ameliorate the condition. That is, psoric patients are better by natural eliminations. So this is very important. In psoric condition, the ameliorating modalities, in short, are better by natural elimination. So any natural elimination will ameliorate the psoric patient. It could be a natural nasal discharge, it could be perspiration, it could be menses, it could be free urination, so on and so forth. So any natural eliminations or natural discharges, they ameliorate the psoric patients. However, in psychotic manifestations, we find that the patient is better by abnormal eliminations through the mucous surfaces such as leukorrhea or even free nasal discharges. So in psychotic, it is the opposite, that the psychotic patients are better by abnormal eliminations. The psoric patients are better by natural eliminations. Pathological developments very rarely take place under a purely psoric manifestation. So, as I told you time and again, in psora, we always get the functional disturbances. Pathological developments are very rarely to take place, especially when the psoric manifestation is purely psora in nature. That means it is not combined with any other miasm. It is only when the stain is united with another stigmata that the pathological condition arises. So, if pathology is to be taken place, or if it takes place, it shows that the psoric miasm is in combination with some other miasm, either the psoric miasm in combination with the psychotic miasm, or psoric combination miasm with the syphilitic miasm. So only when this taint is united with another stigmata, then the pathological condition will arise. So remember, in pure psoric manifestations, only functional disturbances are there. No pathology develops except of the first stage of inflammation. And when the psoric miasm is in combination with other miasms, then the pathology will start developing. Especially when the two or three are united in the same individual, the vital energy is not powerful enough to overcome the pathological formation. So Robert says that when the two or three are united, two or three meaning the stigmata or the manifest or the miasm. So when the psoric miasm is there and it is a combination with psychotic miasm or combination with three, that is psora, syphilitic, and psychotic, then what happens in the same individual, the energy is not powerful, so vital energy is not powerful enough to overcome the pathological formations. So the vital energy gets deviated and the pathology will start forming. So more the miasms or more complex the miasm is, more difficult it is to treat, because the pathology may be initially reversible and then it will go into the irreversible condition. So if you have psora along with the psychotic miasm, there's quite a possibility that the pathology could be reversible, or it could be a borderline pathology between reversibility and irreversibility. But if psora is there with the syphilitic miasm, then you know that there is a pathology which is advanced and it may go into an irreversible pathology. Or if psora is there, psychotic and syphilitic are there, all the three miasms are there, then the disease will traverse from functional disturbances to the pathological changes. Initially, they will be reversible. Later on, as the disease advances, it will become irreversible. Malignancy is developed in the presence of the combined stigmata. So if malignancy is there, then the reason behind the malignancy is the presence of the combined stigmata. So it could be a tri-miasmatic disease with psora, syphilis, and psychotic miasm or stigmata being present at the background. Thus, they are difficult to treat and are impossible of real cure under any form of treatment except by stimulating the vital energy. So in such conditions, when there is more than one miasm present, or when the fundamental miasm is heavily loaded with the miasmatic activity in the form of a complex miasm, then it becomes difficult to treat. And real cure is almost impossible. And if you want a real cure to take place, you have to stimulate the vital energy, but that will also depend upon the pathology what you are treating. So the pathology will determine whether the condition is curable or not. And that pathology is because of the underlying miasm. So it will depend on what miasm is there and what is the pathology revealed. Accordingly, the cure or palliation will take place. Other conditions difficult of treatment, such as epilepsy and true insanity, are also manifestations of the combined stigmata. So other disease condition Robert is saying, like epilepsy and insanity, also they have the combined miasm or the combined stigmata, which they are difficult to treat. These are usually tubercular in origin, being a grafting of the syphilitic onto the psoric fault. So epilepsy, true insanity, Robert says, it is a tubercular stigmata or a tubercular or tubercular in origin, or the tubercular miasm is there, in which the psoric fault is there, upon which the syphilitic miasm is engrafted. Psora seldomly develops pathological manifestations when it's alone, and the trouble may remain quiescent. So whenever psora is present singly, it never develops any pathological manifestation, and it remains in the quiescent form. But when there is more than one basic dyscrasia, one is at once inflamed by the other, and the disturbance manifests themselves. But Robert is saying, but when there is more than one basic dyscrasia or stigmata or the miasm, then what happens? The inflammation will take place, or they will get aggravated, and the disturbances will manifest. So naturally, more the miasms, it is difficult to treat. Less the miasms, it becomes simple to treat. In treating the combined stigmata, the most outstanding must be treated first. So in treating the stigmata or the miasm, whatever miasm is most prominent or most outstanding, that has to be treated first. Since we base our method of treatment upon symptom similarity, and when psora is present, psora will be the most outstanding in the symptom totality in the earlier manifestation. So Robert says, since we are treating with symptom similarity, and when the psoric miasm is present, naturally the most outstanding features of the totality will be of the psoric manifestations. So these manifestations must be treated first. Then after it is eradicated or considerably lessened, the next most potent dyscrasia, and it expresses itself in the symptomatology, must be treated until this too is eradicated. So as he says that in treating combined miasm, the most outstanding must be treated first. So if psora is most outstanding initially, all the manifestations of psora has to be eradicated first. Once it has been eradicated or it has been considerably lessened, the next most potent dyscrasia or miasm has to be treated. And in this way, you have to go on treating layer by layer or miasm by miasm, and until total eradication takes place. So remember, whichever miasm is prominent, treat that first, then the next, then the next. In this way, you will be successful in eradicating the miasm. The treatment should continue in this way, each time treating the most dominant stigma as expressed by the outward manifestations until cure is attained. So Robert says that you have to treat the most dominant miasm, and which is expressed by the outward manifestations of the signs and symptoms until cure is attained. Nevertheless, our treatment must always be based upon the totality of symptoms as they manifest themselves. So again, he reminds us that always take the totality of symptom into consideration. The homeopathic physician has the power to forestall the destructive processes of many chronic disease and to stop the development of conditions that would inevitably lead to fatal termination. So Robert says that the homeopathic physician has the power to stop the destructive processes of many chronic disease which are dependent upon the miasms. And in this way, the physician can even avoid fatal termination of the patient's health. So if the remedy is correct, if the miasmatic activity which is dominant you've taken up is correct, and you've given the simillimum, then you will be able to overcome the fatal termination. So that's all. So in this chapter, so I finished completely Psora. Next time I'll be doing the psychotic manifestations from the Roberts textbook. Hope you enjoyed the video. If so, please give it a thumbs up. Thank you for your patient listening.